I'm Nurse Halley.
I'm Nurse Steve.
And we're the case managers for a patient today that we'll be visiting in her home. So the chapter highlights we'll be going over are defining care management and case management, and second, situating case management as a key component to home visiting. Our objective will be identify the relationship between care and case management as a philosophical underpinning to the care given by community health nurses in the home.
Yes. All right, so the definition of care management, it is the evaluation of healthcare interventions, including need and appropriateness of care and the actions taken to attain effective and efficient outcomes. So this is where we're really trying to apply the interventions and the plans that we would take and we would make into the care of the patient. And the case management definition is a collaborative process of assessment, planning, facilitation, and advocacy for options and services to meet an individual's health needs through communication and available resources to promote quality and cost-effective outcomes. These are all things that are building blocks to care management.
So specific case manager roles include being the advocate for the patient and providing the education to the patient. So different education things could be different services to meet psychological needs, different support groups, different financial resources that'll help them aid for their care. We'll also be the ones providing the facilitation between clinical care and home care and different doctor's appointments and what exactly they'll be needing in their transition through different stages of their chronic illness for our patients specifically. There are many other roles such as we're going to help perform goals setting and outcome setting for the patients and help them reach those through different resources such as physical therapists and nurses and neurochecks, etc. So we're going to demonstrate what exactly case and care management are when they're applied together. We're going to do this by having a patient, which will be demonstrated by me. I will be a 65-year-old woman who suffered from a stroke 2 years ago. I suffer from right-sided weakness and a decreased cognitive ability of like 30%. Sometimes I forget things, sometimes I have a hard time thinking through things. I'm able to perform ADLs, but it's with trouble. I can't stand or walk for a long period of time, so I can get to the kitchen to cook, but I can't stand or cook for a long time. So as case managers, we would talk with the different physicians and nurses over this patient and provide a care plan and different goals that we believe, and then we would go talk to the patient about those. So that's what Steve will be doing.
Very good.
So I'm Halley, the patient.
All right. Hi, Halley.
Hi.
I am Steve, your case manager. So how are you doing?
I'm good. How are you?
Doing well. So I hear you're still having troubles with the paralysis and the
Yeah, it's
thinking.
frustrating at times, you know?
Yeah, sure. That's why we as case managers and nurses and your doctor, we got together. We were able to plan out and make a goal for you, which is, I'll tell you now, which is to be able to walk and stand for at least 20 minutes
Wow.
in 6 months. Do you think you can do that?
How am I going to do that?
Well, how are you going to do it? We're going to help you out with the resources we have.
Okay. I just have such a hard time, standing for that long.
Standing that long?
Yeah.
And we have the physical therapy. We have a physical therapist that'll come and help you 2 to 3 times a week and strengthen you and be able to help your coordination.
Okay.
And then, do you have any other questions for me?
Maybe just how am I going to afford all this care?
So you can afford it by the resources that we also offer. We'll look at, as case managers, we'll look at your financial situation and your insurance.
Yeah, that's good because I don't have a provider right now,
Okay.
a husband or anything.
Well, definitely, and we'll talk about that.
Okay.
And we'll also bring in the nurse and to be able to perform vital signs checks on you and to also have your cognition with different tests.
Perfect.
All right.
Thank you.
All right. I'll see you later.
Okay. Thanks for coming to my home.
Yeah.